Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hello and welcome to another episode of the Sleep is My Waking Passion podcast. This week's episode is extra special and unique because it represents a true collaborative effort. I was fortunate enough to be invited to be a guest on the Kindly Neurodivergent podcast with Kayla Ireland. She is a 26-year-old woman living with cerebral palsy and epilepsy, and we discussed sleep specific to various neurodivergent populations, including cerebral palsy. So I asked her if I could share the episode because she communicates using a computer, and she agreed. So this episode is really repurposing the episode that Kayla shared to give you guys insight into how people who are neurodivergent can better communicate and function in the real world. And you can see just how talented and bright and interesting Kayla is. And I am looking forward to doing a future episode with her soon. Her being a guest on my podcast. So I hope you enjoy.
Hello.
Hello.
Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today, Dr. Kole is here with me. She will be discussing addressing sleep challenges in neurodivergent individuals, holistically. Dr. Kole is the founder of the Oak Health Sleep Telemedicine Program and a board-certified specialist in sleep medicine, pulmonary, and critical care with over a decade of experience. She offers comprehensive, patient-centered virtual care for sleep disorders, integrating evidence-based approaches like cognitive behavioral therapy for insomnia, CBT-I, with holistic strategies tailored to each individual. Dr. Kole is passionate about helping people experience the transformative power of healthy sleep. She also hosts the Sleep is My Waking Passion podcast and speaks nationally. Welcome, Dr. Kole.
Thank you so much, Kayla, for having me. Do you prefer Kayla or Kay? Either one is okay? All right.
Please introduce yourself.
Kay, it is a pleasure to be here and speaking with you. I am a pulmonary critical care and sleep medicine physician. I have suffered with chronic insomnia for many, many years. And I used cognitive behavioral therapy in addition to really examining the other aspects of my life to improve my own sleep health. And it's a very, very personal journey for me to do this and work with people. I am deeply passionate about being able to provide meaningful sleep advice to people of all walks of life. And the neurodivergent community is one that's also close to my heart. My youngest has symptoms of ADHD. And I know what it's like to have my own sleep struggles. Fortunately, she happens to have ADHD, but be a pretty darn good sleeper. But I know that many people in the neurodivergent community may have issues with that. The other thing that I do have experience with is in helping patients who happen to have cerebral palsy. It hasn't happened often, but I have a few cases where really meaningful, wonderful outcomes have happened because they've come into my life and been able to see me in the office. So it is such a pleasure to be interacting with you today and to be on your show. I truly appreciate the invitation.
Are you sleeping better?
I am. I am. It's a work in progress and it's been slow to improve. Probably one of the biggest things I did for myself was actually twofold. The first is I made a commitment to myself to pick a time of day that I would wake up 7 days a week to help with my chronobiology, my ability to regulate my sleep by creating a healthy pattern that was in alignment with my natural chronotype, the times when I want to be awake and the times when I want to be asleep. The second happens to be the fact that I figured out a way to manage my stress, which resulted in some.
365 days a year?
Oh, that's a terrific question. The answer is kind of a more complicated one, which is it's often assumed that when people are sitting here preaching, if you will, about quality sleep, that what we're really saying is you need to have this perfect sleep. It needs to be every single day. That's not realistic. It's called having more good days than bad, is how I look at it. And that adjustment in mindset has been huge. Even in a week, honestly, for me, as somebody with insomnia, I will tell you that I often will get at 5 out of 7 days where I'm pretty consistent and I'm getting between 7.5 to 8 hours of sleep a day. Um, and that I'm generally able to fall asleep in a reasonable time frame, again, keeping that regular wake time. But typically there'll be a day or two where I simply have a little bit more energy, a little bit less ability to relax my mind, and it'll take me a little bit longer to fall asleep. Once I'm asleep, sometimes now that I'm older, I may feel a little hot. I may have to throw the covers off. I may notice a little bit more awakenings. But what I have allowed myself to do is understand that the goal of sleep is to have more good days than bad. It's not about perfection. And letting go of that has really transformed my approach to just kind of seeing sleep in a different way.
Sleep is so complicated.
It is and it isn't, meaning it seems complicated, but sometimes the way to get to better sleep is to realize anything complicated. You break it down into steps and you do what you can for each of those little steps. And then it becomes far less complicated and completely manageable.
Many neurodivergent individuals, especially those with autism, ADHD, or anxiety, experience chronic sleep challenges. What are some of the most common patterns or struggles you see in this community?
Well, I love that you were bringing up number one, the fact that when you're looking at talking about neurodivergence, even prior to this call, we had mentioned it. It's not a one size fits all. And probably all of us have some aspect of a bit of neurodivergence, whether we know that or not. But you mentioned two very specific categories, so I will address those. But I want to also mention that you, as somebody who has cerebral palsy and has epilepsy, as you mentioned to me, you're someone who also is neurodivergent, and you may have some of your own issues. So I want to talk, I don't want to forget that because it's often left out of the conversation because the focus is often on autism and ADHD, but we're going to start there. So about 80% of autistic individuals have some type of sleep issue. And if you look at the statistics, it's probably if you're autistic, you have 2 to 3 times the quote risk of having some issues with your sleep compared to a quote neurotypical person. So it is very, very common to have some issue. If you're looking at ADHD, that's a little bit less common for there to be a sleep issues, but up to a quarter to half of ADHD people may suffer with some sleep issues. If we're talking about one of the biggest ones, that's very common. It's the it's what I suffer from, which is insomnia or challenges with my sleep. And in particular, the two biggest challenges are probably either falling asleep or maintaining a sleep. Um, that can be for a number of reasons. And if you look, there can be often overlap. Okay. So, one of the things that we often see with people who have trouble sleeping in the autism spectrum, as well as ADHD spectrum, they may just have a difficult time winding down. And then there also may be sensory processing issues that are mixed in with that. And so it makes it harder to create that ability to go to sleep. Also, very interesting in the autism population is data that supports that one of the reasons we want to go to sleep is that we make melatonin. And that's because our brains sense light. We're very visual creatures. And when the light goes away when it's at nighttime, we start to release melatonin, which assists us in being able to go to sleep. There may be some genetic modification, some gene differences in autistic folks that lends them to maybe not produce as much melatonin. We also see issues with ADHDers also having trouble winding down. The other aspect of it is there's something about the timing of when melatonin is released. For each person, it's different. But in general, we all mostly function on a slightly longer than 24-hour schedule. And when we see light, it helps to entrain us. And then we are able to kind of fall asleep around the same time and wake up around the same time. But if you're someone with autism or ADHD, you have some neurodivergent features, what can happen is sometimes that your internal clock is a little bit longer than everybody else's. So you really kind of don't want to go to sleep until much later than everyone else. And we call that a delayed sleep phase. So what happens is when everybody's really tired and ready for bed, 10 o'clock ish, right? A pretty normal ish time. Someone with neurodivergent traits may not want to go to bed until 2 o'clock, 3 o'clock in the morning, right? And that can happen even in kids that normally would be on an earlier timing. So my children, for example, I have an 8-year-old and a now at the end of the month, she'll be 10. So an 8 and a 9-year-old together right now. And both of them are prepubescent. They haven't quite hit puberty. So they both naturally want to go to sleep a little bit earlier. I have worked with patients who are in their same age group or in their teens. Teens typically naturally have a delayed sleep phase, but some kids that are really young in their age group can still manifest that really delayed sleep phase, and they may not want to go to bed early, even though all the other kids do. And it's very unique to them. So that's another issue that kind of contributes to their difficulty sleeping. A couple of other things to keep in mind as well. I had mentioned to you that sometimes people can have difficulty with maintaining sleep, meaning they can fall asleep and then they have these little awakenings. That sometimes has to do with the fact that they're more, if you're neurodivergent, especially in the autism and ADHD category, you may be just sort of more, for lack of a better term, hyper vigilant about what's going on. You may be very sensitive to the environment. Little things, you're more sensitive to the external stimuli. And so little things may bother you or wake you up and kind of disrupt your sleep. So that's another thing that we see sometimes. With ADHD in particular, we also see an association with sleep disordered breathing. So sometimes we see people have obstructive sleep apnea, especially the kiddos, and their manifestation is because they're not breathing optimally compared to other kids. They may wake up more, they may be more irritable, they maybe have all the features of ADHD, but really it's sort of a side effect, for lack of a better term, of untreated sleep apnea. And so treating the sleep apnea may help them concentrate better and help some of the mood swings and, just the processing of everyday sort of environmental stuff that may help to kind of help them relax and get rest?
I used to have seizures falling asleep or waking up from naps.
Really? Did they ever test you? Because this happens to be pretty common in the cerebral palsy population for any issues related to your breathing, because sometimes we do see that.
I have dysphagia.
Okay. So when you eat, um, are there any issues with you being able to take nutrition through the mouth, or do you have a feeding tube or a combination?
Takes me 1 hour.
Oh, you can eat, but it takes you a long time. So, one of the things that I figured I would segue to, if you're okay with this, Kayla, is kind of talking a little bit about some common sleep stuff that we see in the cerebral palsy population. Would that be interesting? All right. All right. So, apparently, obstructive sleep apnea, kind of depends on when you look at the tests and the studies that have been done. But some of the studies estimate about 20% of folks with, I'm going to call it CP for short, have, is that okay? All right. So 20% of kids with CP may have sleep apnea, but what's thought is it may actually be closer to 40%.
Whoa.
Yeah. And that it's underdiagnosed. And a lot of it may be because kids can't often tell you, especially if they're younger, what's going on with them. So they may not present similarly, so people are unaware that that's an issue. The other thing, and I wonder if this has ever been a problem for you, is that up to 10% of CP kids can sometimes really move their legs a lot, like kick periodically. So if you've had a sleep study, sometimes they may see that your legs are bopping periodically, or you may have uncomfortable legs, something that we call restless leg syndrome, which can happen. And that can one of the things to consider is making sure you've got enough iron in your diet, because iron deficiency can really kind of cause issues with legs.
I have been getting iron transfusions every so often since last year.
Wow. Okay, very interesting. Did you have issues with your legs, or that was just something that sort of that they noticed?
Annual blood work after aging out of pediatric.
Mm, okay. Well, I think it's great though that you are having that managed and that people are checking that blood work. That is so important.
Especially since my body works so hard.
That is a great point. Yes, a lot of athletes also get iron deficiency because they're so active, and every day you're an athlete. You really are. You're remarkable. You're remarkable. Do you, what I didn't know, and until I was prepping for our talk today, is that up to 65% of CP folks can actually have some discomfort. They may have musculoskeletal pain. If are, they may get spastic, the muscles may spasm. And that can be very disruptive to sleep. It sounds like you've at least had some spasticity. Do you have any particular concerns about your sleep that you've noticed?
I don't, but I contribute to the seizure medication.
Mm, that's true. I also didn't realize that 41% of folks who have CP also have epilepsy. They have seizures. So it's very, very common.
It relaxes me just enough.
It relaxes you just enough.
I always feel like if I wasn't, would I have sleep problems?
I think if you generally feel like you're sleeping okay, I say, God bless you. God bless you. Because some people have CP and they have sleep issues. So if it's not a problem for you, hallelujah. My patient, if you'd like to hear a story, one of the things that made it possible is as a sleep doctor, one of the things I really care about is if you've got a problem with your breathing and I want to keep your airway open so that you breathe better at night. I know overall it will help you, but I've got to think about, what the treatments are and if that's the most appropriate thing for my patient. And you can imagine that if you needed a lot of help with masks, fittings, and turning on a machine and doing all of those things, how something like a CPAP, which everybody you see pictures here of my little heads, how that could be more challenging.
Mm.
And so my particular patient did really well just with being on a machine with a mask, but it's because his disability from cerebral palsy, or his challenge, he did have some physical challenge, but he had more mobility in his fingers and he didn't really have any issue with being able to take the mask on and off. Safety is something that I always take into consideration, because if you're completely dependent on someone to put the mask on and things like that, it would be really hard to have that mask, especially if your mouth opens when you sleep and we need to do something that's more like a full face mask. Like, what if the air goes into your belly and makes you feel like you want to vomit, right? So we've got to be careful because we don't want you to accidentally have food or secretions go down the wrong pipe and go into the lungs and cause something called an aspiration pneumonia. So sometimes we have to think a little outside the box. The OG of hypoglossal nerve stimulation, it's an implantable device. I have an older generation here to show you that gets implanted under the chest wall, and there's a lead that goes up to the hypoglossal nerve. There's a small incision that's made, attaches to hypoglossal nerve, and then there's another lead that attaches to one of your respiratory muscles. And what it does is it's like a pacemaker for your tongue and it helps move it out of the way.
Oh.
So, yeah, so they're thinking if a patient with cerebral palsy is appropriate for it, it could be considered. Obviously, there's a lot that goes into that. That's something that I read in the literature. I'm not aware of any major cases specific to that patient population. I'm just saying, but it was something that I found very fascinating that people are looking into it as a potential consideration.
How do neurodevelopmental and sensory differences contribute to disrupted sleep patterns?
That is a great question. Um, you know, if you are someone who really struggles, maybe even with texture, being very sensitive to sound, light, all of these things can impact your ability to relax and surrender to sleep. Because ultimately, that's what happens, right? We're all capable as humans of this very unique ability to basically stave off sleep. We can kind of talk ourselves out of it unwittingly or on purpose. And those sensory processing issues mean that you may be more sensitive to light or specific textures or sound. And so, there are certain folks in the neurodivergent world that may even create almost like a cocoon in their bed, which seems like, we often talk about you want the bed to be comfortable, you want it to be cool, you don't want too much stuff on it, you want to be able to really stretch out and relax. That might be the exact opposite of with someone who's neurodivergent needs. They might need a little cocoon of stuffed animals and their comfort toys, and some may even need something that they can play with to fidget. My daughter, for example, loves to just like twirl little animals, and she used to fall asleep with books until she whacked herself in the eye in her sleep, and we decided that was a bad idea. Sharp corners. So we stopped doing that. And she creates like a little cocoon, and she likes to sleep in her cocoon. So she may have like a pillow kind of angled up so she can't see anything. She likes her stuffies surrounded, whereas my other daughter may not need that. Some also, because they may end up needing to fidget or move their legs a lot, it's a little bit more difficult to get settled. So there's some data that suggests that using something that's a little bit heavier, a weighted blanket or a weighted pillow, for example, may help to be somewhat calming and soothing, because there is like a reflex that allows that. So it's almost like a deep pressure calming effect. And that's the idea, is that if you distribute pressure to the body, either more locally with a pillow or with a weighted blanket, that can feel very comforting to folks and kind of allow them to relax and surrender to sleep. The other aspect of it, especially if you're talking about someone who may be on the more autistic spectrum, is sometimes the compensation And this may be in the cerebral palsy population as well. I just don't know off the top of my head. So you can educate me on this.
Uh,
But sometimes a lot of screen use and a lot of entertainment with shows and other things to keep your brain occupied is what they're used to.
yeah.
Yeah, but it's hard because when you're trying to go to sleep, we really don't want you to be in front of those screens the whole time.
Mm.
And often in neurotypical people, they may have a longer time wind down routine, if you will, to get to bed. So that may look like I've brushed my teeth, I've taken a bath, I've gotten my PJs on, I'm reading a book. It could be this stepwise process that could last over an hour. And what I've been reading about is that neurodivergent individuals, a shorter bedtime routine may actually be more beneficial just because it's less stuff to process and have to
Yeah.
do. So a quicker routine may be a better way to get to sleep rather than a longer routine.
What are some common signs of sleep problems that families or caregivers can look for?
One of the biggest issues is if there are a lot of behavioral issues that seem really resistant to classic therapeutic interventions. So, the tolerance for discomfort, the tolerance for change, the tolerance for little things that don't go our way, right? I to give a classic example, if my youngest daughter with ADHD, if I try to move her from one environment to another, classic
Mm.
example would be it's after school, you now have an activity, we need to go. We really struggled last year to be able to transition her from I've just arrived home on the bus to immediately need to get on the bus and you need to go to your other activity. It
Yeah.
was really a struggle. This year, we said, number one, I don't want to fight her on an activity that she doesn't want to do. She really took an interest into Taekwondo. So we did that. And the Taekwondo class is a little bit later than normally I'd be comfortable with it. She gets home at 4, the class is at 6:30. But what it does give her time for is time to play,
Very.
yet time to do some homework, and then she's ready to go and she's willing to go and she loves it because she's had time in between transitions. You may notice that some of those classic behavioral strategies may not be working. That's time to consider if there's something issue, if there is a bigger issue. The other thing is if you hear signs that something seems off, the patient snores. Kids are not really, I mean, if they're really kind of loud snorers, that's not really typical. If you're noticing pauses in their breathing, kids honestly have a different criteria by which we measure obstructive sleep apnea than an adult. And in an adult, if you have 5 events or more, you have sleep apnea. If you have one an hour, that can be a sign that something's going on with you're a child. So you don't need very frequent events for it to become an issue. Are they falling asleep even though they theoretically appear to have gotten enough rest at night, right? If they're really struggling to be able to even fall asleep in the neurodivergent population, there is data that very, very, very small doses of melatonin can be helpful. 0.5, 0.75, 1 milligram, very, very small doses of melatonin sometimes help to get patients to be able to fall asleep. And if you take it, you kind of figure out the right timing, it could right be before the bedtime that you're looking to, readjust them to. They may be able to get to bed in 30 minutes versus 3 hours, like the 8-year
Yeah.
old I saw the other day who, was on a baby dose of melatonin and it had significantly improved how she got to sleep. So these are things they're not out there in weird type of alternative voodoo therapies. There's actual literature that supports these types of things. So these are some of the considerations. I mean, other things to keep in mind, to be on the lookout for, I think, with educators. If just having some sleep education can be helpful for parents, just so they kind of understand what that routine looks like. One of the ones that really stuck out in my mind, and it was based on an episode I did on my podcast, was I didn't think about the fact that I naturally did this with my kids, but some people opt to do it closer to bedtime is this idea of the bedtime bath, that you're
Mm.
going to have a bath right before you go to sleep.
Yeah.
And one of the things that is very difficult, that can be very unsettling to kids, is that they like bath time is not like in adults. Adults, it's like functional. I've got to clean stuff. I'm done. Now I can move on to my next task. Kids, it's playtime. They've got they have all sorts of adventures in their head, right? So when you're trying to take them away from playtime, they can be very unhappy with you. So sometimes actually adjusting the bedtime routine in terms of getting them to bathe earlier to give them that entertaining feeling can be a really great way for them to then later wind down. The last piece I will say is don't forget, for any parents out there, how much your kids, no matter what their issues are, know that they love you and they want to spend time with you. And if they don't feel like they're getting enough parental time, it may manifest in some behaviors that make it more difficult and more challenging for them to go to sleep. So just keep that in mind. Sometimes it's about procrastinating just so they could hang out with mom and dad for a little bit longer.
Especially when you think of developmental differences.
Absolutely. Absolutely.
How can caregivers implement sleep hygiene techniques without overwhelming the person they're supporting?
This is a fantastic question. And what the literature points to is go slow, small increments, less complicated, shorter duration of routine, implemented over time. Make the changes more gradual. I use the example of my daughter in getting her to an after school activity. I do the same technique when it comes to winding down for bed. We don't go from, hey, it's playtime, we're doing stuff. Oh, it's 8:30, it's time for bed. Go to bed now, right?
Mm.
We start to transition. It's 7:30, 8 o'clock. Do we want to have some time with mommy and daddy? Do we want to watch a show together? Do we want to read? What is it that we feel like doing? Because soon you have to go to bed. So I just start the idea a little bit sooner. And I really try to be very mindful and very patient. Now, I am going to say I'm a little biased because my older one tends to resist bedtime more than my younger one, even though the literature would support that she would do the opposite. And there are times when she's like, I'm ready to go to bed. I'm peacing out. Bye. And she just takes off, even if the rest of us are like, oh, okay. So sometimes she will go to bed on her own, even when she is ready, which I love. I love the fact that she can be independent and strong willed enough to say, this is what I need, and I'm going to advocate for myself. So encourage that in your children, encourage it. But work with them according to what you think their personality needs and trying to figure out something that would relax them. So, in other words, maybe if Kayla, for example, if you're really like, I love to watch this particular show or do this particular thing, yeah, it's not less than ideal to have like bright light in your eyes or what have you, but you can put it on a dimmer. Maybe you can even wear those little blue blocker glasses that might kind of reduce the desire to be up. And you watch that show because that's what helps you relax. But then, you know, for a younger patient, the parents say, after this show, it's going to be bedtime. While you watch the show, you brush your teeth or whatever it may be, that you get them so that they know we do this. This is for bedtime. We watch our show, we brush our teeth, we go to bed. And then so there's a stepwise progression. And again, building in that quality time with them as well, so that they're not sort of craving that before they go to sleep.
And transitions are tricky.
They can be so tricky. And that is neurotypical and neurodivergent. We're all difficult transitions. Think about it. I'm sure you have your difficult transitions. Mine have been on a more global scale, like transitioning my career, for example, but it doesn't matter how you label it or when it happens in your life. We all struggle with it. It's a change.
Yeah.
Cognitive behavioral therapy for insomnia is often a gold standard. How can it be adapted to better meet the needs of neurodivergent individuals?
Again, Kayla, your questions are brilliant. They really, really are. Cognitive behavioral therapy, there's a certain structure and cadence, right? But as I was mentioning to you, when you're a neurodivergent individual, you may need that cadence to be different. There may be some role. Number one, if the person really has a tough time making it to a physical location, maybe they live far away. Maybe it's a very big to do to get the wheelchair and get them transitioning into a
Yeah.
vehicle and all the accoutrements that go along with that. Some may even need a ventilator or some oxygen or some other things. They could be very complicated to transport from point A to point B. There is no reason in the year
Weather.
2025 or weather, yes. And there is no reason in 2025 why we can't do online digital cognitive behavioral therapy. There is strong data coming out. A lot of the research has been done in Australia, actually, but a lot of research coming out that digital behavioral tools can be, very similar in their efficacy to meeting one-on-one. I do think that digital tools, if you're not directly meeting with someone, there's a little bit less personalization to that. So that's just a little caveat that we need to keep in mind. But for example, I have a concierge sleep telemedicine practice. All of the individuals that I work with that struggle with their sleep, we meet one on one digitally. They're not coming over to my home, though I would welcome them, uh, you know, uh, or an office space, right?
Hmm.
We're working remotely. And so being able to accommodate the person and meet them in their home environment has certain advantages. For example, I can see what is the structure of your bedroom? Is it safe? What's the lighting like? Do you have the blinds wide open or are you pulling them down so it can be dark? What temperature is your bedroom set at? Some of those basic things that can be triggers for people to not sleep well can be very helpful. There's some literature in the neurodivergent population that a shorter course of cognitive behavioral therapy, the standard is anywhere from generally about 8 weeks ish or so, roughly 8 to 10 weeks, sometimes 6 to 8 weeks. So you have this bit of a window, but a shorter course may be better. Some parents have described that that's better for their kids. What I have seen,
Why?
why? I think for parents, if I had to summarize, I think in part, we have to be mindful of caregiver fatigue. It
Yeah.
is, kids, especially if they have if they're neurodivergent, they may have more, their special needs. And so the parents need to be able to accommodate that, but also accommodate working and maybe caregiving for other kids and just creating a family life that works.
Yeah.
So sometimes that can be a real challenge for folks. Um, I I do think, though, that I wanted to give an example to you of someone that I am seeing currently, and we're treating a sleep apnea. He is neurodivergent on the autism spectrum side of things. And, um, he's working with a lower dose of melatonin to help him with sleep. We're working on actually some naturopathic type of remedies that he can take as well to try to sort of calm the nervous system before sleep. And that seems to be helping him. But we're also working on cognitive behavioral therapy. One of the things we talked about transitions. One of the very difficult things is wrapping his mind around less time in bed will improve his sleep. That's been something that he's really struggled with because he very much likes a fairly complex routine. So simple, he's been sort of going against the grain, meaning he has a more complex routine. It is a routine that allows him to have less anxiety about his sleep. And we could not do sleep restriction, which is sleep restriction therapy, which is a component of cognitive behavioral therapy. We could not do that in a way that we felt would be safe for him because his behavior is so sensitive to sleep.
Hmm.
So what we did was he's on week 10 and we're still working on the sleep restriction component. And we're finally starting to see change. But the change I saw in a positive direction took about 10 weeks. And with very slow, sometimes every 2 weeks, we'd modify. And by 15 minutes, the schedule. That's what worked for him. And that's okay. So everybody's different. Some people may need a longer time and more modification to what's happening. Other folks, maybe their attention is such that they can devote so much time and then they really they need a break from it. And that's okay too.
Yeah.
What should schools, workplaces, and healthcare providers do differently to help neurodivergent individuals prioritize and access restorative sleep?
Well, I'll tell you right now, the number one thing that all schools throughout the country should be doing, and it's unlikely to happen, um, except on a state level because of how our government operates. We'd make changes on a state level, then there's the governmental level, and sometimes you can do things federally where it's a rule throughout the country, and then other times where we're limited to it being just a specific rule in a state. And in the case of this, what I'm about to say, it's district by district within a state. It's not even a state thing, except at least not in New Jersey, where I'm from. Okay. Which is later school start times. That is the number one thing we can do to protect the sleep of our adolescents and our teenagers. And why this applies to neurodivergent kids is because I mentioned to you how many folks have trouble getting to bed at a certain time, that they have a naturally delayed sleep phase. Teenagers, neurotypical or neurodivergent, all struggle with delayed sleep phase. It's human biology and how we hit puberty and things just sort of change for us. Our biologic clocks change. That's just human biology. So let's lean into the fact that we know this stuff about science and science is cool. And let's apply science-based, evidence-based strategies to improve the sleep of everyone, right? So that's number one in terms of what I would do to protect the health of children. The other thing I would encourage parents to do in the home, believe it or not, is to model good sleep habits in front of your kids. Neurotypical, neurodivergent, we are humans who look up to our parents for guidance, right? And if our parents demonstrate that sleep is a priority and something that should be appreciated as being important to our development, to our brain health, to our physical health, to our abilities to function every day, if we as parents do that for our children, they see that and it becomes a natural part of who they are. We're modeling that behavior. So we should do the things that are good for our sleep too, you know? And believe me, as a parent who works, I cannot even begin to express to you what a joy it is to not be spending 100 hours a week in the hospital and
No.
spending a lot more time with my children and to watch them develop and watch them actually be fearful that mommy's going to go back to the way she used to work because they want mommy around. And there's nothing that could possibly make me want to do anything but cuddle with them before bed and spend quality time with them. So I'd encourage parents to do that and to lean into that because the relationship with your children it could change the trajectory of both of your lives in terms of how you just view what's important in life. Because life is short.
Yeah.
How do you personally define restorative sleep, and what small steps can someone take to move toward it, starting tonight?
So restorative sleep. Do you wake up and you feel like you've gotten sufficient sleep for you? What that looks like for you, Kayla, may be different than what I need, right? But are you getting sufficient sleep for you?
Mm.
Is it as consistent as you can make it? Not perfect, but pretty consistent. And do you perceive that the quality is pretty good? That's really how we define what, quote, healthy or good sleep looks like. To get more granular, it's going to depend on person to person. But if you know you've been shortchanging yourself on sleep, maybe there are reasons that you're doing that. Maybe you're just working very long, hard hours. You don't have very much me time and you procrastinate to get to bed. maybe your bed really sucks and it's uncomfortable and you've had the mattress for 10 years and you're like, I don't know. It costs a lot of money to get a new mattress. Maybe I'm delaying it. Get that new mattress. Invest in it. Figure out a payment plan. Do it, right? Make sure, very basically, that you're not going against the grain. Make sure your room is a comfortable temperature, if that is afforded to you. If you can afford air conditioning and it's hot outside and your room is 76 degrees, full transparency, I woke up thinking I was having a hot flash the other day. It just turns out that we forgot to put the AC on and it's become hot in New Jersey and it was 76 degrees in my room. I'm like, no wonder I'm sweating. Adjusted the temperature, core body temperature cooled down. I was able to restore a decent rest just by flipping on the AC, right? Not everyone can afford that. So I understand that there are struggles out there. But if it's something that's afforded to you, take advantage of it. Make sure that your environment is dark. A lot of patients tell me, no, I need to have something in the background. I need to have white noise. I need the TV to be on. You really don't. You think you do. And the question is, dig deeper. Why is it that you think you do? What kind of thoughts are you having that bother you so much that you feel like you need to have constant distraction from them? Are those thoughts healthy and positive thoughts? Can we reframe how we think about that? And, that may mean that if you really prefer some noise to help just get you out of your head, I have a lot of patients who that's the case. They make little earbuds. I just got these ones from Oslo. Oh my goodness, they're so comfortable. I actually don't like a lot of white noise, but I listened to last night. I was just needing to take my mind off of stuff. So I gave myself I timed it. I gave myself 30 minutes to scroll through social media, TikToks, listening to silly stuff. And I know that it's not the best, but it's just what my brain needed. And I timed it. I gave myself 30 minutes to do so. So I literally set a timer. And I scrolled, I did whatever. I had my little earbuds in and very, very comfortable. And for some patients, I may have them listening to an audiobook. They may be listening to, I've also done this where if I'm having a particularly rough night, I would lean into YouTube where I could turn the phone off, but I can listen to like a sleep meditation or a sleep hypnosis type of program on YouTube. That's been really helpful for me to get out of my head when I have a very busy brain. But I also allow myself to have a busy brain during the day where I can reflect on why I'm having a busy brain. I really try to be very introspective about how I'm feeling and why I'm feeling that way. And sometimes it's as simple as clearly my hormones are wackadoodle today. I'm having a moment. I woke up angry and I want to punch everybody in the face today. It just is the way it is. Okay, I'm going to accept it. Other times it may really be that I'm bothered. Maybe there's a challenging project or a challenging situation, or I'm feeling particularly anxious about something. That happens to all of us, but I lean into that feeling and just sort of be with it for a bit and try not to escape it. I used to spend so much time being like, this feeling is bad. I don't want to feel this way and try to push it away. Now I just go, there's no such thing as good or bad. It's just where you are at and not judging being in a bad mood, not judging, not being perfect today with being nice to everybody or feeling optimally positive today. Like life crap happens. And so being able to roll with the punches a little bit and just know that ultimately God doesn't make mistakes. And maybe some people don't believe in that, and that's okay. But in my world, God doesn't make mistakes. We're all here to lead a human experience and to do the best we can to make the planet a better place. So let's just, use sleep as a tool to accomplish that. That is something anybody listening can start to really dive into, and you can start to do these basic little things.
Thank you, Dr. Kole, for doing this with me. It was great to have you on.
I
Share this
honestly,
talk show with your family, friends, clients, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.